Hi, thanks for tuning in. My name is Sara Kay. I'm an esthetician here at the Dermatology and Skin Cancer Center, and I often get the question, which order do I use my products? Well, where do I put this one if I'm using this one? So I'm gonna try to clear that up for you so you get the maximum amount of benefits from your at-home products with whatever you use. Regardless of what you use, where you bought it, doesn't matter. This is the best order so that your products penetrate the deepest and get where they need to go. Also, FYI, you don't wanna mix growth factor serum with any of your acids. So you wouldn't mix growth factor serum with glycolic acid, alpha hydroxys, beta hydroxys, and especially salicylic acid. It will actually cancel it out. So keep that in mind as you are applying your product. You have to pick one or the other. So if you're dealing with acne and you're trying to prevent aging, use one in the morning and the other at night. All right, without further ado, morning routine. If one of these products doesn't apply to you or you don't have it sitting on your shelf, no problem. Just skip to the next one that I mentioned, okay? And if you have questions, comment below the video. I'll get right back to you, okay? All right, first and foremost, morning, you cleanse. So if you don't cleanse, skip to the next step. It would be toner. If you don't use toner, which I'm indifferent about, skip to the next step. This is your growth factor serum. Growth factor serum. Unless it says eye cream, everything is meant to be used up to your orbital bone, okay? Stay away from the eyes, unless you've tested it and you do fine with it around your eyes. Because I have to tell you, growth factor serum, it makes your collagen grow. And if you're not super sensitive to it, it's gonna be great for that crepiness around the eyes that starts to happen as we get older. So you can test it out, see if it works for you. Growth factor serum feeds your collagen, makes it grow. Next up, your antioxidant. This is generally speaking vitamin C, and I say generally because there are so many different types of antioxidants, and oftentimes you'll find a vitamin C serum with other antioxidants and also peptides. And what peptides do is support your collagen and support your cells. So they're like little bubbles around, keeping them from breaking down. So really important stuff. Vitamin C lightens, tightens, and brightens your skin. It corrects damage that's already occurred in the deeper layers of the skin before they even come to the surface, and it prevents further damage from occurring when you go out in the day with the environment, the sunshine, and anything that you come into contact with. So it's more important to use your antioxidant in the morning than in the evening. So if you're picking a time of day, use it in the morning. All right, next up. You would moisturize at this point if needed, or if you have other serums, you would use that before your moisturizer. So if you have other serums, like a lot of people like to use hyaluronic acid, you'd put that on top of your antioxidant to kind of seal in your moisture. And then moisturize only if needed, okay? So depending on the time of year, this might determine, and the day. If you're using allergy medicine, that'll dry up your skin. So you might need a little more hydration. No problem, this is the time to apply it. Lastly, your SPF. So apply your SPF, you would put your makeup on top of that and go on with your day. That's your morning routine. All right, let's bounce to the evening. In the evening, you must absolutely wash your face. Take the time to cleanse your skin. All right, after you cleanse your skin, if you use toner, you would use toner next. Again, I'm indifferent on toner. If you like it, use it, no problem. All right, some people like to use a scrub. You would use a scrub a few times a week, probably not every night, and just be careful that it's a nice scrub that's not going to scratch the skin. So a scrub that you would use on your body, you don't necessarily want to use on your face. Anything with nuts and seeds can sometimes cause microscopic tears in your skin. So avoid that type of scrub if you use one. Next up, eye cream. Use your eye cream now. If it is something that contains a touch of retinol, then you probably want to just use it on the lower portion of your eye. If it's a hydrating eye cream and it has a lot of like peptides and antioxidants in it, I use it. I would bathe in it if I could, but I rub it everywhere. See if you're sensitive to your eye cream, and that's gonna determine where you use it. But generally speaking, eye cream is meant to be used right here, all the way out, and always use your ring fingers because they're typically your weakest fingers, and so you're less likely to pull the skin. Just tap, 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 maybe rub outward slightly. Actually, don't rub, sweep. Let's sweep. Yeah, we're gonna use semantics here. All right, next up after your eye cream is your vitamin A. So retinol, or this is gonna be your tretinoin. If you're not using that, You can use glycolic acid, lactic acid, salicylic acid if you deal with breakouts, alpha hydroxys, beta hydroxys, so many acids. If you're using an enzyme, now's the chance, okay? So you would use your enzyme all the way up to the orbital bone, around, put it on your skin, and then moisturize if needed. Okay, if you have other serums that you like to use on top, you want to make sure they're not anti-aging. Generally speaking, a lot of the anti-aging serums don't mix well with the acids. They actually break it down. So again, I'm just reiterating, don't do that because you're wasting product. That's it. Go to bed, wake up. Hopefully you feel awesome and rejuvenated, and check in with me next week. I can't wait to see you next Wednesday.